I can't tell you how many times I heard a patient walk by my door after they had spent a half an hour with our care manager saying, wow.
The learning collaboratives have been really great because they get some carved out time from my day to go meet with other folks in other practices.
The grant helped because the deliverables that they have, and one of them is population management, and it was just absolutely perfect.
Over the last 4 years, 65 medical practices have partnered with Finger Lakes Health Systems Agency to transform primary care delivery. With funding from the Center for Medicare and Medicaid Innovation, the practices have added a care manager, expanded their use of clinical data, and adopted a team approach to care.
I was frustrated as an office manager because we had this wonderful EMR system, electronic medical records, that we had been collecting data for 3 years. Yet I found it extremely difficult to extract just the right data that could be useful for me. So my background is in mechanical engineering, actually design and development supporting manufacturing processes. But I'd also be the first one to say that a human being is not a manufacturing process. So we have to be careful about how we use the metrics. When I started this out, I actually printed this. Yeah. And I posted it on the wall, and everybody looked at it and went, oh my God, what is this? The initiative helped us kind of refocus and figure out different ways of even potentially extracting data, and particularly our focus was with diabetes. You know, what is the goal for a diabetic patient? Well, the best marker to be tracking is an HbA1c. So we started tracking the improvement that we had made per patient over a period of time. It was a very telling graph because it just showed 47 patients and had their A1c gone down or up. And I think on the end it was like 90% had actually gone down over about a 6-month period, with the impact of the care managers' coaching and change. And so that was kind of revolutionary, that particular graph. And so we took it from there and expanded it and said, geez, we should really be running these reports on a monthly period. This is actually a program that we're working with vaccine manufacturer and just trying to improve vaccination rates for particular vaccines. Just recently we had a nurses meeting to review this, and you know, certainly they all look at this, the national average versus where we are, and they love it to be actually see it graphically and say, yeah, we're killing it. This is the best thing ever. But we got to keep going up. Where's the 100%?
The learning collaboratives have been really great. It's probably the best part, thinking-wise, of the CMMI grant. I get to think about my practice from a different perspective, and also from a bigger perspective, not just within our group, but within Rochester Regional's medical group, but then also within the county, and how we all do things. Really a lot of fun. One of my favorite collaboratives was Pat Bomba coming to talk about the eMOST process. eMOST is electronic medical life-sustaining treatments, and it's basically how patients can limit their care for all the invasive contemporary treatments that we offer. Pat's a great speaker, she's a great doctor. She came in and really kind of gave us a good framework for when to bring that up, how to bring it up, and that is going to be a big change in our practice. One of the things that CMI did when we got our care manager was we created a care team meeting. In our care team meetings, we have tried to tackle COPD and heart failure. We've done a little bit about diabetes. We've done some social problem patients, for example, chemical dependency issues. One of my partner's patients who has a number of social issues, she has a number of kind of chronic end-stage conditions, was just bouncing in and out of the hospital, and she was labeled non-compliant and her family wasn't involved. And I think when we talked about her after probably her 3rd admission in 2 weeks, my partner Kelly got some great ideas about how to change how she was approaching things, different medicines, how we might coordinate with her specialist, a little differently, and I think that kept the lady from going back into the hospital, probably cut her admissions by 50%. It made a huge difference, and then the following meeting for our care team, which is every other month, we got to hear how that worked.
Okay, everyone, it's like 8:30. We meet regularly twice a month, and this started through the CMMI initiative. It's a collaborative meeting of everyone, and we do brainstorming on the process improvement. We will look at our patient flow and how well that would help the patient.
The blue shows a patient that's had a colonoscopy, but we don't have a result for. The brown is for a patient that's absolutely declining colonoscopy.
We picked a colorectal screening measure because the numbers were low, and as a practice, we feel as a team we are missing something. What is it we can do to better help the patient with outcomes and the patient for their wellness and health? Before, the process was to where we kind of gave it to the patient, kind of like, okay, if they said, oh, not at this time, I'll schedule, or I have to look at my calendar, whatever that they use at that time, we allowed them that, you know, and I think that's where this fell through. The first step is for the education piece. We had corporate of the hospital design 2 posters, and at one of our PIT meetings, we chose the poster that we thought felt best fit this practice, and we placed it in all the patient exam rooms. The second part is to have the receptionist actually schedule the appointment. In that process, if there's barriers to where the care manager would be brought into it to help connect with the patient, to help them beyond the office visit, to help alleviate those barriers, whether it's transportation, financial, more education, and beyond the visit that we need to do for the patient, that's what the care manager will do. Our colonoscopy numbers were originally in the low 40s, and once this process was implemented, and within a short time, they're in the high 50s. It takes a team to get these numbers going. It's not just one person. And between the receptionist, provider, nurses, care manager, this patient is really in a good place, I feel, here at Shortsville.
As the Practice Transformation Initiative wraps up, medical offices are continuing down the path of patient-centered care, from keeping care managers to holding regular meetings that involve everyone in the practice working together as a team.
I really feel with our team here that we have at Shortsville, everybody did their part, from the provider, the receptionist, the nurse, and the care manager. It's all patient-centered, and that's where our improvement happens, and their visit to this practice is improved.
Having a care manager is definitely part of our DNA. I think everybody has seen the impact.
So I think in the future, we're going to continue to try to do care team meetings. Hopefully we can keep tackling some of the tougher topics, and people will learn both about the patients but about the topic.